Hi, and welcome to this educational video. My name is Emily Egan, and I am a nurse educator based in Brisbane. The aim of this video is to provide healthcare professionals in an oncology setting a visual demonstration on how to decontaminate a cytotoxic spill. If you are watching this video, you will have completed the online ADAC educational module, Handling Anti-Neoplastic Drugs and Related Waste Safely, and are wanting a visual demonstration on how to decontaminate a spill prior to your mandatory assessment. At the end of this video, you will be able to correctly don and remove PPE during a spill decontamination and demonstrate the correct procedure for decontaminating a cytotoxic spill. All content for this video has been adapted from Hospital Policy and the Workplace Health and Safety Queensland Guide for Handling Cytotoxic Drugs and Related Waste Safely. So, let's get started.
So when you first come across a cytotoxic spill, you need to stand at the site of the spill and make sure that you defer anybody that comes close. If there are patients or patients' family members nearby, you must ask them to leave the immediate area to protect themselves until the spill has been cleaned thoroughly. You may also ask your colleague to bring you a cytotoxic spill kit. In this kit, we'll have everything you need to do your immediate clean of the cytotoxic spill. In your cytotoxic spill kit will be all of the PPE that you're required to put on prior to cleaning your spill. First, you must put on your respiratory protective equipment. You must make sure that the seal is across the bridge of the nose by doing your fit check. Next is your protective eyewear. If you have glasses, you must remove these, or you must wear a face shield over the top of your glasses. Then you will require 2 pairs of these purple cytotoxic gloves. Place 1 pair on, and these will sit underneath your cytotoxic gown. Then you will place your gown on, making sure it's sealed at the back. Then you place the second pair of cytotoxic gloves over the elastic cuff of your gown. You must make sure that the cuff is fully covered by the gloves. Then finally, you have your cytotoxic boots. Once you have all your PPE on, you must then put together your cytotoxic waste bags. In the kit, there will be 2 bags, an inner and an outer bag. This white bag must be placed inside the purple. And positioned close enough to the spill so that you don't have to travel with the waste once you've cleaned it up. When cleaning a spill, you have two options: a dedicated cytotoxic mop and bucket or a bowl with soapy water. Your colleague can bring either one of these to you to help you clean the spill. If in your spill there are any pieces or large objects, use your scoop provided in the spill kit to lift them up and put them into your cytotoxic bag. If this is not required, you may leave it to the side. Then, from your kit, take the chemosorb cloths and place them over your spill to ensure all of the liquid is soaked up. Once the liquid is soaked, collect the chemosorb cloths and place them into your cytotoxic bin. Once the spill has been soaked up, using the bucket of water that your colleague has provided to you, take the cloths from the spill kit, soak in copious amounts of water to decontaminate the area. Using an outside inward approach, clean the area as required. Once the area has been cleaned, use the paper towel to dry. If you require more of the paper towel, use the lint-free towels provided by the hospital. Once the spill has been decontaminated, you must remove your PPE, starting with your boots. Placing them in the inner cytotoxic bag. Then you must remove your outer gown and gloves. Pulling the gown forward whilst bringing off your gloves. And placing it into the cytotoxic bin. Using the zip ties provided in the cytotoxic spill kit, you must zip tie the inner bag, being sure not to expel any air. You must then remove the remainder of your PPE and place it into the outer cytotoxic bag, starting with your gloves. And then your goggles, and then your respiratory protective equipment. You must then wash your hands with soap and water, not the gel or foam. Soap and water will ensure that any residual cytotoxic agent is thoroughly removed. Once you've washed your hands, you must then don PPE to remove the cytotoxic waste bins. Then, using the zip tie from the spill kit, zip tie the external bag. You can then remove the waste to a rigid wall receptacle.
So in summary, this video has provided a visual demonstration on decontaminating a cytotoxic spill, as well as demonstrating how to correctly don and remove appropriate PPE. I hope this has assisted in showing how to apply theory into practice and that you now feel more confident for your assessment. Please contact your nurse educator or clinical facilitator if you wish to practice any of the steps from this video. So thanks for watching and good luck with your assessment.